So I chose to do the PRC program at the Mayo Clinic. Uh, it really just came about by one of the physicians at the Mayo Clinic. We were at sort of a last resort stage really in my life. I was very close to going on disability at work, and I was not in a very good place, and was able to get into the Mayo Clinic to see a physician. And I believe I was actually the second class in Jacksonville. So he, when I got down there, recommended, said, "Hey, I have a program for you. I think you would benefit from. Can you be here in a month?" And I said, "Yes, absolutely." So that's what really got me to Jacksonville and into the PRC program. Sure. So sort of looking at my functionality before I got to the Mayo Clinic, um, I was in a very bad place. I really could barely work. I was working a full-time job, but was barely making it every day. It was all my energy just to make it even a few hours. Like I mentioned before, I was very close to going on disability. I could hardly really stand up and walk due to the pain and the stiffness of my muscles and the weakness of my muscles. Throughout the program, I noticed a really increase very steadily through those 3.5 weeks. That it slowly my mobility was improving. I'm now a little over 3.5 years out of the program, and I can really truthfully say I've really recovered almost probably 98% functionality of what I was doing before my injury and for the pain that I was dealing with at the time. I think some of the biggest challenges that I faced during the program, of course, was going through the taper. I think anyone who's going to go through the program, and that's a hurdle in itself, and it's a challenge. But the staff and the nurses and the therapists were so wonderful and really helped to, lead us through and lead me through that taper off all the medications. Um, and I think getting out of the program, it was trying to find a fine line of what my mind wanted to do compared to what my body could do. And so that really took a few years, or truthfully, at least a few years, to find the balance of what I could actually do without having major flare ups, without having sort of a progression of the pain and um, or the weakness coming back. And so that was something I had to slowly find out over time through a trial and error type program. I think I was able to incorporate all the tools from PRC right away because of um, everything that Dr. Sletton and all the doctors and all the nurses and therapists gave us and prepared us to go out sort of back into our lives. I mean, we were very well prepared to step back into daily routine. Um, looking at sort of trying to follow a regimen of exercising, stretching. For me, I was very intentional on following those steps because it was working. I saw and during the program that the exercise and the flexibility, also, and then incorporating everything with the mental side of everything that we learned. I was able to apply that slowly into my daily life. That really gave me sort of the tools to deal with stress of everyday life, and then being able to manage the pain to a level where I was back at a functional level. I think the biggest tools or strategies that really helped me um, was staying consistent and not beating myself up. There's gonna have bad days. We all have bad days. Everybody's gonna go through the program's gonna have bad days. There's gonna be days when you wake up and you're stiff or you're hurting, and it's not. it's so easy to just say, oh, it's one of those bad days, I'm going to roll over in bed. But I felt very well prepared to say, no, that's not what I need to do, because if I do that, it's only going to get worse. I need to make myself get up, take a step in front of another foot, and get moving. And so I think having those tools of being able to just to know that it does work, and to really follow through with that. And that was the biggest thing. That was sort of the challenges. Going back to the challenges, that's what I had to learn, is to really trust the program. And I think that's what's given me success over these years, is trusting the skills that everybody taught me down there, and applying them to everyday life. Sure. I mean, my quality of life has returned. I mean, 100%. I mean, I'm able to be active with my family again. I'm able to have relationships with friends and family that prior to PRC, truthfully, were on the rocks. I mean, there were so many friendships that were lost due to the pain that I was in, and different type of mobility issues. So coming out of pain rehab, and walking through a lot of the um, different tasks and skills that I learned has really brought my quality of life 100% back. I mean, I'm very active now, and you know, live sort of a full glass mindset now. Where before I was very pessimistic about life and about the pain that I was going to have to deal with for the rest of my life. Where now it's totally turned over, and I'm very optimistic, and know that I can live a good life but still manage my condition. Talking specifically about maybe our families and close friends, and how they would react to the program, and different things that I had to talk to them about after the program. It was a big adjustment for them. I came out looking 100% better than I did. And they all thought, oh, great, Mike's better. What can we do? We're ready to get back into life again. But that was not the case. Had many bad days, after that. I had to really learn to stand up for myself. I think what happened is during this period before PRC, when I was basically a patient, truthfully, and people were taking care of me, and so I did what people told me to do. So I had to really learn again how to have a voice, and how to stand up for what's right for me. And I think that was a big adjustment for my family and my friends, when it looked like, oh, I can go do this and it would be great, maybe in that certain activity. But I knew if I did that, there would be a consequence, and I'd pay the consequence the next day, or that it wasn't worth it. And so I had to slowly, try to explain that to them. And it was definitely an adjustment. They had to learn to trust me again, and to say, okay, we'll back off, maybe not push you, and give you the space that you need during that time. Explaining moderation to them, and what that looked like. And truthfully, moderation, it really has changed over these 3.5 years. I mean, coming out, maybe 6 months out, my moderation was, I could barely maybe walk. We have a lake in my neighborhood. I could barely walk maybe a quarter of a mile. Where just about 5 months ago, I ran a half marathon. So moderation has changed tremendously, and my body has changed tremendously in adapting to what I can do and what I can't do. But that took time to really find that out for myself, and then to let others see what that looked like also. I think my social circumstances have changed some, and looking at my friends, and I really found, I guess through this whole thing, I found out who my friends really were, because they were the people who stuck by my wife and I during this whole situation. And I think through the program, it gave me an insight of really seeing what's most important in life, and those are the ones that are closest to you, and those are the ones who are going to care about you. And so I think through that I was able to, pick friends maybe a little bit more wisely, and have that change a little bit. So it was a very positive experience. Sure. I think when I look at the opportunities that I have now and looking towards my future, it's truthfully open for anything that I want to do and accomplish. Uh, Before PRC, my life, the only life that I could see for myself was my wife taking care of me and me being on disability at 26 years old. That was my reality at the time. Um, Now we have a beautiful 3-year-old daughter, and hopefully another one soon on the way. And looking at job opportunities, I mean, great opportunities there. I'm able to live a full life, playing sports again, and being active in my community and in my church. And so it's uh, it's very exciting for me to look towards the future. I think the biggest advice I can give people is they really have to ask themselves if they're at the point of truthfully wanting help. And I think because if the person doesn't truthfully want help, the program, I don't know if it can help them. I think that they have to be at a place um, where as much control that we all want over our lives, you have to be able to release some of that control. And I would be upfront with somebody, telling them that this is, you have to trust doctors, the nurses, the therapists, with almost 100% of your life, because it's giving up yourself to a program that over many years has been successful. And that's what, for me, in my case, that's the only thing that I held on to, is I looked back and said, this program, which is just starting in Jacksonville, has been successful for many years in Rochester, has helped many people. And that's all I have at this point, is I have to know this is going to help me. And just having that one glimpse of hope and belief in that, I think was able to drive me to my success and to where I am now. I think the advice I would give current PRC patients is to be patient. This isn't a quick fix. Uh, I think one thing that was a big surprise for me was um, actually some of the after effects of the medication. I felt like I was very foggy in my head even 6 months after the program. And so that was an experience of just trying to not get frustrated, because I was starting to feel better, but my body wasn't there. And so it's to stay patient, be consistent with the program, be consistent with your physical therapy, your exercise, your flexibility, um, and then be consistent with your relaxation exercises. Because if we can't control our nervous system and really slow our body down, I don't think we're going to be able to truthfully control the pain. And so that's what I would try to tell people, is just trust the program works, and really try to just tell them to be patient and take it a day at a time. I think the biggest thing is, I mean, I'm sure y'all have heard it before, but the program truthfully did save my life. There's no question that I wouldn't be here. I mean, I wouldn't have the family that I would have now. I wouldn't have the job I have now, if it wasn't for PRC. And so um, I'm just so thankful for all of you guys and all the work you do every day. And I know you don't, it's a job for you guys, so you might not feel it, but it does impact people on a big level. Sorry, I'm tearing up because it is a big deal for me. So I think I really almost went a full year. I think I made it 11 months without any type of flare up or anything. No, almost no pain, and had sort of a big situation come up in our life that sort of shook our family a little bit, and that, quickly brought me back down. And without the skills that I would have learned, I mean, it's amazing how the nervous system can, sort of quickly shut down your body. And it took me almost 3 days after that big event to go through, all my routine of stretching and just relaxation to get. But as soon as I did all that stuff, it came back, and in a couple days, I was back like I was before. So it is really amazing what the brain can do, and I think that's what I hope people will can learn about the program and understand is our brain is so powerful and our bodies are so powerful, and we can achieve so much if we're willing to let go and to really trust, in the program.